We will now discuss probe handling, probe position on the chest, and scan plane. When examining the pleural space, the probe should be positioned in the intercostal space, perpendicular to the ribs, in a longitudinal orientation, thus parallel to the long axis of the body, with the index mark on the probe oriented cranially or cephalad, pointing towards the head of the patient. In the supine patient, the probe should be positioned first in the posterior axillary line in the lower aspect of the chest, corresponding to the most dependent area of the thorax, which should be where an effusion will pool unless it is loculated. As previously mentioned, optimal visualization of the pleural space and lung will be achieved by longitudinal scanning along the intercostal spaces. Such a longitudinal orientation of the probe will provide an excellent assessment of the relative position of their various anatomical structures, allowing to correctly identify the exact localization of pleural fluid in relationship to the diaphragm and internal organs such as the liver, spleen, heart, and lungs. Pleural space imaging should preferably not be performed in the transverse, also called axial plane, as this plane does not provide as much information about the relative position of the surrounding organs. Transverse imaging of the chest is performed by holding the probe in the intercostal space parallel to the rib, with the index mark pointing towards the ventral or anterior aspect of the patient. The resulting view provides the same plane of imaging as that obtained by a CT scan.